It gives me great pleasure to introduce again Dr. Dick Wenzel, the emeritus chairman of medicine for VCU. Dick is an expert at epidemiology and has a number of really important insights that are very relevant to preventing the spread of this disease.
A lot of people are interested in seeking safe airline travel. And of course, this is a big business if you look to the right, 3 billion passengers a year. And you may or may not know that it's 50% outside air versus recycled air. And that sort of combination maintains a modest level of humidity because it's extremely, almost a desert dry otherwise. The air happens to be HEPA filtered, and there are complete air exchanges every 2 to 4 minutes. And I would point out again, very, very dry air. So people who say, well, I was on a plane, I get a cold every time I'm on a plane. I understand that. And it's probably because our mucous membranes are not protecting us. So if I go to the next slide, and what you want to have is try to think about ways to seek safe airline travel. So if you look to the seats, if you will, exemplified here, and you go left to right, it's aisle seat, middle seat, and window seat. And what it shows is how many people left their seat during a 2 to 3 hour flight. 80% on the aisle, down to 58% in the middle, and only 43% if you had a window seat. And correspondingly, if you look under the diagram, the graphic, the number of contacts in that flight, if you were on the aisle, now people going back and forth as well as you're getting up, 64, a little bit lower than 58, and way lower, 22, if you stayed in your seat, in the window seat. Now, if you look to the right, we don't have a lot of data, but a transmission of MDR tuberculosis, an airborne bacterial infection, in an 8-hour trip from Chicago to Honolulu, if you were within 2 rows of that person, 31% of people got infected. If you're beyond 2 rows, it dipped quickly to 3.6%, but even some people 15 rows away. Now, whether those people went by the infected person's row or whether this was transmitted by aerosols, unclear. But the risk ratio, if you were within 2 rows, was 8.5. If you look at the middle, SARS, 16 of 119 passengers who were within 3 rows got infected, and the risk ratio was 3.1 for 3 rows versus beyond 3 rows. So beyond 3 rows, you still could get infected, probably not beyond 10 to 15. And the one study of H1N1, they just showed the attack rate as 3.5%. What we don't have data on, just an anecdote, if you will, I'll show you in a minute. So how do we reduce the risk of airborne travel? 1, call the airline, seek non-crowded flights. Some of them are still keeping the middle seat open. That's the airline you'd rather be on instead of being a packed plane. Get on a window seat if you can. Stay in the seat if possible. And wear a mask for the entire time that you're inside the airport. You get your ticket, you get in line when you're bored and get off the flight, and the whole time you're during the flight. You could even consider face shield or goggles just to protect the exposure to your conjunctiva. You could think about, there are some people saying you should turn the nozzle on towards you. This is knowing this is HEPA filtered air. So there's probably no risk at all. Disinfect the tray and the surfaces you touch. Carry hand antiseptics, and of course, importantly, use it. Now here's a comforting anecdote, and that's all it is. A COVID-19 patient flying from China to Toronto, many hours, wore a mask the entire flight. There was 0 transmissions. So the data I showed you on the prior slide, people didn't wear a mask all the time. We're in the era where I'm telling you, wear a mask. And that's one anecdote, but a little bit encouraging, that if everybody on the flight wore the mask all the time properly, you really reduce your risk.